Hello, my name is Carmel Harney. I'm the Assistant Director for Allied Health Professions Governance, Workforce Development and Training in the Southern Trust. We recently ran a best practice event for allied health professions, and the theme we chose for that day was one of patients taking centre stage and sharing the stories of their experiences of the allied health professions who had provided a range of interventions for them. The event took the form of very much a patient-centred approach, where our patients, clients and their carers came along and shared their story very openly, very warmly, very sensitively, and most of all very humbly, in terms of the difference that they believed that allied health professions made to their health and well-being. It was a truly successful event from the point of view of the patients sharing with us what was important for them in terms of their allied health profession intervention and care, and how all of that transferred in practice in terms of their very own experiences. So what was really inspiring about the day is that the patients, the clients, the carers who came along to share their stories were very committed to the whole principles of self-help, self-management and maintaining as far as possible their health and well-being. And they were openly committed to sharing their stories so that other patients and carers could be inspired by the ethos of self-help and self-management, which is central to how allied health professions work with their clients and patients. I'm sure you'll all agree, and indeed you'll judge for yourselves when we now see the following video clips of the stories from our patients and clients who use the allied health professions. And there's no more true barometer than hearing from patients and clients themselves of how they really felt AHPs supported their health and well-being and helped maintain their independence and maintain them in their employment, in their leisure and in their full community and family lives.
Hi, my name is Jamie O'Neill. I work in the community stroke team in Armagh and Dungannon. I'd just like to introduce Rose Casey. Rose Casey had a stroke in April 2016 and she was initially admitted to the Royal and then transferred to Craigavon to acute services and then non-acute in South Tyrone and then discharged home under the care of the community stroke team. She was then referred to day hospital and voluntary services such as Chest, Heart and Stroke, Disability Action, GYM programme and Stroke Association. Rose is a shining example of how all these services has helped to aid her recovery and the benefits of them all. She has made fantastic recovery and continues to make recovery 10 months post-stroke. Rose is a remarkable lady and an absolute inspiration. And I remember saying to me in therapy that she never looks back on her stroke, she always looks forward. So I'd just like to end on wishing Rose the best in all her future care.
Hello, my name is Rose Casey and I had a stroke on the 27th of April 2016 and I spent time in the Royal in Craigavon and Lone House and I received rehab in physio, OT, speech and language and nursing care. One of the therapies that I received was so important to my recovery and that was physiotherapy. It would give me back my independence. At the beginning of my physio, I couldn't walk. I needed a steady or a wheelchair to get to my physio sessions. I started with the very basics, sit to stand. I was part of a project where they photographed me my every move. When I didn't get it right, I had to do it again and again. Focusing on these basic skills helped me to develop and to take a bigger challenge like walking. The physios were excellent and so patient with me. Currently in physio, I walk independently. I have gained strength back in my leg and my arm, not fully, but where I was before my stroke, I am getting there. This has been achieved through a personalised programme tailored for me by the physios. Lots of different exercises, some quite challenging, but very worthwhile. Having access to lots of different types of equipment, for example, parallel bars, resistance equipment, and also different techniques from the various physios to get the best out of me. Then I was introduced to OT when I was given the encouragement with personal care, with washing and dressing. I was encouraged to stop nursing my arm. It needed to be used. And they were always saying to me, if you don't use it, you lose it. And they are right. Big achievement, I made a cup of tea. And that was a big achievement for me because with the OT, I was able to go to the room, put on the kettle, put a tea bag into a pot, boil the kettle, put the water on the tea bag and pour a cup of tea. And when that was all done, I was able to sit down and have the cup of tea. And that was a great achievement. And as I said before, whenever I took my stroke, I was making a cup of tea in the house. So this was really a big achievement for me. Then this brought me on to the biometrics, and where the OT was using a program, biometrics E-Link computer program to strengthen my arm, my leg, and develop my range of movement. The games got more difficult as I improved, so it adjusted accordingly to my level of improvement. There were games, balls in a basket, exercise for grip strength. At the docks, I was loading and using my grip strength for loading crates at the docks. I was using a pegboard. I was using the Wii, so you could play games here as well. So this was a great part of my achievements. It wasn't all boring stuff. It was exciting to be able to play a Wii, and I hadn't played a Wii for years. All these activities, they encouraged me, the OT gave me encouragement, and we could see from 1 week to the next the improvement that I was making. Everything was recorded. The other therapy that I received was speech and language, and I didn't like speech and language. This was something that didn't really appeal to me at all. And those girls came in to me and they would say to me, Rose, give me the names of 10 fruits. Rose could start off and she'd do well and she thought she was doing great. And then they'd say, Rose, give me another 5. And I thought, oh my God, here I have to go again. I have to do this again. But I would, name 10 fruits, and I was naming things like a pomegranate. And I thought, what's wrong with an apple? Or 10 modes of transport. And one of the things that I mentioned to them as a mode of transport was a catamaran. Now, what was wrong with mentioning a car? But because of my brain injury, these simple things weren't coming to my mind. I was frustrated and I didn't like it. But at the end of the day, it really worked. When they tested me in the hospital, I got a 0. I didn't score anything. And then after I had been out of hospital and in my own home, and the speech and language therapist came to my home and she set me out this test. And I got my full scores in those tests. And those were tests that I had done earlier. So therefore, I have a big thank you to the speech and language people who persevered with me and listened to me moaning and crying and not being able to do whatever. I got signed off then by the speech and language for talking too much. But it's something that I would like to do. I would like to do a wee course on it. It's something that I think it's very important to any stroke patient to stick with speech and language. even though you can get frustrated and you can't remember the 10 things and whatever. My therapy then continued in the community, and through the Chest, Heart and Stroke Association, I attended Mullinure, where I took part in exercises and listened to talks about various lifestyle. I then proceeded, I was referred by the physio to the gym, and I go there twice a week and use different equipment to get myself fit again. The key to my rehab was the patients shown to me. The staff never got frustrated, and they always gave me encouragement. Excellent guidance. It was always explained what to do and what I would be doing next and what I was doing well. Clear communication. Staff always spoke to me in a way that I understood. Excellent demonstrations and modelling of what I had to do. Staff were always hands-on. I felt cared for at all times, and the care was second to none. My advice to anyone who's had a stroke: it is important for patients to set realistic goals and to listen to the professionals. Have as many sessions as possible and always ask for more or take extra if it is offered. To give each session everything you have. Get involved in as many things as you can in the community, and they all help to get you back to normality quicker. Give it all you have. And I would like to take this opportunity to thank all the staff for their patience and their help in helping me to achieve my goals.
Hi, my name is Olive TRACY, Diabetes Specialist Paediatrist based here in Lurgan Health and Social Services Centre, also covering Portadown and Craigavon. Today I have a patient with me, type 2 diabetic since 2009, and he would like to share his story with you.
Hi, my name's Brian Hamilton, and I'm here today to tell you the story of my diabetic ulcer I got in my toe, and also the treatment I got in Craigavon Early Hospital and secondary in the pediatry in Lurgan Hospital. The story starts with when I was in work one night. I put on a boot when I was starting my shift. It was full of water and I never thought anything of it. I just changed the boot, put a new boot on, and a few days later I happened to notice a redness in my foot. But being a diabetic and having little senses in my foot, I didn't think much of it, so I continued to work till eventually I couldn't get my foot into my shoe. I had swelled so much. I started to panic, and I was greatly advised to go over to A&E in Craigavon Hospital, thinking I would be there just for a few minutes. I went in, and the doctor, the triage nurse, looked and sent me to the doctor, and he sent me straight to ward, saying how serious this was, as being a type 2 diabetic. And I didn't know nothing about the seriousness at the time, so I went up and they put me on antibiotics, and I was in the hospital for the first time for approximately 8-9 days, and when they released me, I went home and they dressed me, and I went to the pediatrist in Lurgan Hospital. They took off the bandage and discovered it had got like a gangrene, and they rushed me straight back to the hospital. And they put me on more antibiotics, and they kept me in for almost 2 weeks. So in the end, nothing was working. And the consultant who was dealing with my foot decided to send for larvae, which he put on, which actually cleared up the infection in my toe. And they were happy enough with what they had done, so they released me with more larvae on my foot, and the nurse come and took it off. So they sent me straight to my pediatrist in Lurgan Hospital, and that's when I first met Olive TRACY, my podiatrist, and she was taking care of me for the first sessions. At that stage I wasn't out of the woods because the infection had actually got into the bone, and due to Olive's expertise, she actually managed to remove the infected bone so the healing process could continue, which it done. And today I just would like to thank Olive and the podiatry team here for the great care they give me. Other than that, I'm sure I would just have been lost statistic of amputees in Northern Ireland. And when I was in Craigavon Area Hospital, the junior consultant and the microbiologist had both recommended amputation. And finally, I would like to thank the podiatry for what they've done, because now I've been back to work for 15 months. My foot is fine, and as I said, only for podiatry, I would probably be a lost statistic.
My name is Valerie Hamilton. I work as a community occupational therapist in the physical disability team in the Southern Trust. I'm working with Deirdre as part of the regional wheelchair pilot for motor neuron disease in relation to Bluetooth development for the wheelchair provision for other clients in Northern Ireland. I'm going to ask Deirdre if she would give us an idea of her involvement to date and her user perspective of the scheme.
Hello, I'm Deirdre. I was diagnosed with motor neuron in September 15, and Valerie Hamilton, my occupational therapist, put me into a pilot scheme, which was in January 16 for this wheelchair, which I received almost immediately. I'm now able, due to the Bluetooth in the chair, to communicate, as I no longer can hold my phone, so I have my phone now attached to my chair and can remain in contact with friends and family, and especially my son in America, who I WhatsApp and keep in touch with. It has been a fantastic advantage for me, because it means now I'm still able to communicate each day. It also allows me to operate my home environment. I can open and close my gates with the Bluetooth in my phone. I can put on off my lights, heating, hot water. So it is very good for my independence as well. We're also now going to have a camera attached to the wheelchair as well, for if I'm out and about, it enables me then to see what's coming behind me, for the safety of myself and for others. With having this now available to me, I'm so grateful, and would like to thank Valerie, Emma and Carol for all their hard work and efforts to be able to keep me in contact with friends and family and maintain my independence. So thank you all very much.
Hello, my name is JOANNE Tilley, and I'm a physiotherapist at DC Hill Hospital, and this is my colleague Sean CURRAN, and he is a physiotherapist in the community stroke team in the Southern Health and Social Care Trust. And would like to introduce NICOLA CORRIGAN, who's one of our patients who had a severe stroke in April 2014, when she had to be rushed to the Royal Victoria Hospital for emergency life-saving surgery, and this is her rehabilitation story.
My name is Nicola Corrigan, and this is my stroke recovery story. When I was taken away to Belfast, I had a craniotomy, which means I had a piece of my skull removed and put into my stomach for a wee skull baby. And then I came back to Daisy Hill for my rehab and my physio. The first thing I had to learn to do was to sit, which is really weird. I can't tell you how scared I was to stand. I had no faith in myself whatsoever, but then Joanne helped me find the faith, and my first goal was to stand for the length of a song, which was 4 minutes and 8 seconds long. I had to do it by the end of the week. I had it done by the end of the day. You can too. By the time I left the hospital in a wheelchair, but then Sean came out and done his physio in the home, and I was able to walk outside and everything. It was brilliant. When I started out, I had to be hoisted from bed to chair and back again, so I knew I had to walk eventually. It was very, very scary, but we done it in the end. And now I'm able to walk around the front Shornworm Point on a daily basis, weather permitting. I just take the stick for more as a visible aid for traffic. I don't even really use it. And now I'm waiting to get my car back, and I'm back at work and everything now, so it can be done. Yeah, I was in a powered wheelchair for a wee while, which was class, but don't get stuck in that. Joanne got me out of it. She wouldn't let me stay in it forever, even though I wanted to. But we had to walk everywhere because it has to be done. My family helped me. I was very, very lucky with my family. They really helped in the physio aspect once I got home too, as well as the rehab team. I would like to thank all the physio, Joanne and her team here in the hospital, and Sean and his team out in the community. They all do their bit to help. Without them, you'd be nowhere. You'd still be in that bed. I would be in my powered wheelchair whizzing around the place. Thank you.
Hello, my name is Helena KINKAID, and along with my colleague Janet Eagle, we are both team leads in X-ray in Craigavon Hospital, and we have set up and successfully implemented a completely new radiographer-led hysterosalpingogram service for ladies with infertility problems within the Southern Trust. This service was set up over 5 years ago under the guidance of the late Dr. Hall. This is a leading light initiative not only within the Southern Trust, but also regionally and nationally. And we have successfully managed to reduce the waiting list for ladies waiting for hystros from 14 weeks down to no waiters. Today, I'd like to introduce KAYLEIGH Timms. She is one of our service users, and she's going to tell you about her experience of our service.
Hi, my name is KAYLEIGH Timms, and this is my testimony. I was diagnosed with polycystic ovaries at the age of 16, so I was therefore told it'd probably be a bit harder for me to conceive. Fast forward a few years, I ended up having 5 miscarriages, but eventually fell pregnant for the 6th time, and I now have a 2.5-year-old daughter. She was born via caesarean section, which can sometimes cause problems with your fallopian tubes. So as I was waiting to conceive a second child, nothing was happening, so I came to see the consultants here at Craigavon, and the first port of call was to be sent to see Helena and the team. I waited for the leaflet to come, and when it came, I recognised the girls on the leaflet, and I was a bit nervous because they knew me. But I thought I'd go ahead, I need to get this done, so I'll get it checked out. So the appointment letter and the leaflet arrived, and it explains clearly what it entails. Partly like a smear, which again was causing a bit of embarrassment because I knew the girls working here, but it needed to be done. So the day came that it was happening, and I showed up at the door, and Helena greeted me with a great smile, so friendly, and along with her team, Janet and Audrey. Couldn't have made me feel any more comfortable. And they had lovely music playing, they had lovely smells in the room, which totally relaxed me. So I got up on the table, they started work, and through no fault of their own, it couldn't be done that day. So we had to arrange for me to come back for another appointment, which the girls were fantastic because I only worked 2 days a week, and their appointment days were always on a Tuesday being my day of work. So the girls said they would call me back in, and they did promptly the following week and got me on a Monday, which suited me so much better. Everything went to plan, and thankfully my tubes are all good. I got a letter. The girls actually told me informally that everything was fine, which really put my mind at ease. And then I got a letter in the post saying the same thing, that everything went grand, and I was waiting to see my consultant. So I really can't thank these girls enough. They made an experience that could have been so embarrassing and unpleasant, very pleasant for me, and hopefully they've led me on the right path of providing a sibling for my daughter Megan.
I'm sure you'll all agree, having seen the range of patient stories in our clip just now, how truly inspiring and positive our patients and clients have been about their experiences, and how committed they have been around the whole self-help and self-management ethos, and how courageous they've been to come along and take centre stage and share those stories in order to inspire and motivate other patients and clients and to share the learning across their experiences. It's been truly humbling for me as the Assistant Director and for all the professional heads of service and staff to have been part of this event and to have seen our patients and clients so engaged and in such a meaningful partnership approach. And we look forward to building on that and to doing more of this really good work with the patients and clients taking centre stage. So can I just say a huge thank you to all the patients and clients, their carers and families who came along to share their stories about their experiences of allied health professions. And a huge thank you also to the staff and our support staff for the care and compassion and services they provided to our patients and clients that led to such a positive experience and outcome. Thank you.